This is part of a series on avoiding old-fashioned dentistry.
So let's take a look at some other patients and see how you can change the predictable outcome of predictable old-fashioned dentistry. Insurance had changed in something,
Yes.
and you went to some other dentist who told you what?
Difficult and expensive procedures are the first thing they recommend.
I talked to one doctor and they wanted to do a root canal and a crown. And of course, very expensive. And I decided to get a second opinion. You looked at it and says, we can fix it. A lot less. I think I've got like $350 in it.
And that's with bonding.
Yes.
And that was years ago, so
Yes.
I think we're not going to need a root canal.
No.
It's the last dentist.
Told me I needed a root canal right after I had a initial cleaning. 2 root canals actually, and 3 crowns.
I went to 3 different dentists. All of them recommended a very complicated, expensive procedure.
Was it crowns?
It was crowns, root canal and a crown, as a matter of fact, yes. And then it was in 2000, and I came here to Dr. Larrick's, and he said I can do this in a more down-to-earth way, and that tooth has held for 8 years without a problem.
Well, thank you. That means we're in 2008, and you're happy guy. Bonding that came out, but you admit to writing something hard, huh?
Yes.
So the beauty of bonding, it's very easy to repair, and we'll just put it back, and we're still friends. And by having an educated patient, they know that there's no problem. Now, because this is so easy to do, I'm just going to use some air abrasion and dust that tooth off like that. Was that easy? Okay, no needles, no nothing. We're going to clean it up and etch it and bond about 5 minutes?
5 minutes.
Okay, and I appreciate what you said about down to earth. We call that conservative dentistry. The most important ingredient in modern dentistry is thinking and discretion. Any dentist can be quick to drill, but you want to be conservative. You want to save as much of that tooth as possible, so if there's a problem 10 years from now, then there's something of the tooth left that we can do a crown. If you keep whittling the tooth down, you end up with nothing.
Yeah, I've always felt, and I've always asked my dentist, if you keep on taking away from the tooth, there will be a problem at some point.
And I've been doing that since 1976, using adhesive dentistry to stick to the tooth and not try to take away healthy tooth structure. And that's an informed patient. Patients are catching on. She just knew that the tooth didn't need a root canal and a crown. Thank you.
Thank you.
Yes, I wanted a second opinion on a tooth that I know it had a small crack, and I went to another dentist and she did some dental work on the bottom left, and then she just moved right to the top right and put metal in a tooth, and I told her I didn't want any metal in my teeth, and said, well, it's not going to show because we're going to put a crown over it. Before I had time to even know what she was doing, she was already preparing it for a crown, and I told her I didn't want any metal, and I know that I don't need a crown. It's just a small crack, and I wanted to have bonding in it. And she just kept moving along and didn't even really ask me what I wanted.
Well, you're an informed patient. Bonding is a lot more kinder to the tooth. You don't have to drill as much as metal. Saying that it's not going to show because it's under a crown, it's still in your body.
Exactly.
And I'm amazed. Patients are finding out more and more they don't want metal in their mouth. Thank you.